Hi, everybody. Welcome to this session of Limitless. And we have a very special episode today because it's October. And this is a month where worldwide it is Breast Cancer Awareness Month. And we want to focus on that in this particular episode. And I have two very prestigious and respected doctors from Davao City with me today. And I'm so glad that they're here. And I'm going to ask them just to introduce themselves, their roles, the institutions they oversee. So I'll first start with you, Dr. Ben Valdez. Could you share with us who you are and what you do here?
Yes, I'm the president of Maharlika Charity Foundation, and I took over the operation of the foundation over 6 years now. And the foundation is quite enriched with a lot of beneficiaries that we actually operate more than around 4,000 cleft kids in total since that we partnered with Smile Train International. But right now, being the president, it's quite challenging because, foundations are donor driven. But we are actually doing a lot of supports all over Mindanao that is actually south of Philippines, where 26 million population is actually being catered by the foundation. And also I'm a trauma surgeon by profession.
Yes. And you also oversee, you're the regional head for One Hospital Command. Is that correct?
Well, yes, I was mandated by the Department of Health Undersecretary Bong Vega to oversee the operations of the One Hospital Command in terms of COVID-related problems. And we do coordinate with a lot of organizations just to get them early and put them in definitive care management depending on what level of disease there is.
I see.
Yeah.
Okay, wonderful. Dr. Alex Tam, could you just tell us a bit about yourself and what you do?
Hi, Amy. Hello, everybody. I'm Dr. Alex Tam. I'm a surgical oncologist by profession, and I'm currently the chairman of the Mindanao Surgical Oncology Fellowship Training Program. It is affiliated with the Southern Philippines Medical Center. It's a flagship government hospital in Mindanao, and also with Davao Regional Medical Center. It's also the major government hospital in Tagum City. With both government hospitals, we operate on a lot of indigent cancer patients, mainly breast cancer patients. And currently, we're very busy taking care of them, and especially since it's October now, it's Breast Cancer Awareness Month.
Right.
So we're busy taking care of a lot of breast cancer patients now.
You know, doctors, this is a topic that means a lot to me. Why? Because it's almost 20 years ago that my own mother discovered a lump in her breast. As I was thinking about this and thinking about this interview, I realized it's almost to the mark of 20 years ago. And so I personally and my family walked through this whole it was a very traumatic time for us, everything that happened. And it's so important that people understand about breast cancer and that, again, that this is October and it's an appropriate time for us to bring awareness. And something that we're going to talk about as well toward the end of this interview is what we can do to help women here in the Philippines. And so it's something that's very personal to my heart, because my family walked through this. Unfortunately, my mom passed away almost 2 years after she first found the lump in her breast. And so this is a very, very important topic.
It's an aggressive type of breast cancer.
Very aggressive, yes. Yeah. Okay. So tell us about here in the Philippines and kind of what's happening in terms of how many women have breast cancer, what are the statistics, those sorts of things.
Breast cancer is still the number one cancer among the different types of cancer. Worldwide, it's number one. And likewise, in the Philippines, it's also number one. Probably by 100,000 population in the Philippines, I would say 150 women out of 100,000 population will have breast cancer.
Say that again. What's the statistic?
150 women out of 100,000 population will have breast cancer.
I see. Okay.
So if you convert that into ratio, 1 out of 9 women will have breast cancer in their lifetime.
That's many women.
Yes.
Yes. Oh. Okay. What are some of because this is awareness and we want to bring this to the international community, what are some of the signs of breast cancer and the screening that should be done? How can people keep themselves safe?
Of course, the most common sign of a breast cancer is a breast lump.
Mm.
If ever you would notice a breast lump while doing self-breast examination, you should go see a doctor. The best way to do a breast examination is while you're in bed, lying down, do the breast examination at least once a month, or while taking a bath, you're with soap, so it's easier to slide down and examine the breast. When you feel a breast lump, go see a doctor. But for women aged 40 and above, the best thing to do is do a mammography, because mammography detects microcalcification, which is not yet palpable. So you even catch breast cancer at an earlier stage if breast cancer is detected by mammography.
And should that be once a year?
Yes, mammography is done once a year. Then self-breast examination is done once a month.
You know, I'm thinking especially, Doc Ben, you might want to address this too, like during the time of pandemic, maybe people are more hesitant to they find a lump or something's going wrong, maybe they're more hesitant to go see a doctor. Do you have that experience or?
Well, that's a good observation. COVID-19 in Davao City and in the Philippines is a game changer. It has actually changed a lot of protocols as well as the systems that is in place pre-COVID. And seemingly the population has gone through a lot of stigma in terms of healthcare facilities filled with COVID-19 patients, which is remarkably that the infection would spread easily just by being with a COVID positive patients, just like less than 15 minutes, and you got it. So in short, those elective surgeries and semi-urgent care surgeries has affected a lot, especially in government institutions such as in Southern Philippines Medical Center. And it is the end referral center where all provinces refer these patients to. But right now, we have accommodated COVID-19 patients, half of the hospital capacity for COVID-19. And you would actually put that in mind that some of the cases are displaced. So that's why it's quite challenging right now, but it is not actually a clean over hurdle that these patients cannot actually have access for care. But right now, with the census of 1:9, as Dr. Alex has shared, the incidence of breast cancer is the number one, especially in Davao City. The access of care has been challenged. That's why, as the president of the foundation, we have to do something about it. It's not just we rely something, but it's a collaboration between government. And of course, you know, Amy, a Global Impact Foundation and Maharlika has been all
Old
time
friends, huh?
partners through
Yes,
thick and thin
it's
that
true.
we have partnered for a lot of humanitarian endeavor. That's why our justification of reaching out to these patients who are displaced. This time we get them, we have to operate them even amidst the pandemic.
Well, tell us more then. What has Maharlika done to address this? Because you're saying in the hospitals and it's not happening, right? So Maharlika has opened the doors so that these patients that are in need can come and have surgery.
Yes, Maharlika Foundation, actually it is pretty much known in Davao City. It's known for reconstructive surgeries, like we deal with cleft, we deal with minor surgeries. But somehow we opened this up because Dr. Alex Tam's team, the surgical onco section in Southern Philippines Medical Center, has made it possible that breast cancer surgeries will be a day surgery,
Yeah.
which is, I think Dr. Alex Tam would probably elaborate that more. But Maharlika is an ambulatory surgery that we do day surgeries. You operate in the morning, you send the patient home in the afternoon, which is actually it zero in addressing during pandemic, but still you do operate breast cancer patients effectively. So that's why it opened the doors for this poor Filipinos and you know, Filipinos are known to be hardworking,
Very.
and
Mhm.
they are ubiquitous everywhere in the world.
Mhm.
They care, and they nurse patients, and then they come home having a breast lump, and they cannot access easily for definitive health care,
Mm.
and they have spent so much money and spent so much time, ending up no money at all, and they cannot even afford to have a consultation.
Mm.
That's why this is where Maharlika and Global Impact sets in this particular challenge, that we are opening the doors for these poor Filipinos coming over, helping those uh, uh, other people abroad, but coming home penniless, and they cannot even have a decent surgery. That's
Mm.
why Dr. Alex Tam here, as a known surgical onco specialist in our city, is doing a good job on this
It's amazing.
patients.
It's amazing.
Yeah.
So there's a real need, and because of collaboratively working together, you can welcome in women that really don't have the money, the capacity to be able to get the surgery, and to be able to offer it to them at Maharlika Charity Foundation.
That's correct.
And as Doc Ben just mentioned, tell us about how it's a day surgery. It's not, they don't have to be admitted overnight, and that this is breaking ground here in the Philippines.
Yes, Amy, it's quite pioneering, as a matter of fact, that we do day surgery for our breast cancer patients. Because of pandemic, our elective surgeries in the government hospital have been shut down recently. So our cancer patient surgery has been piling up. So we thought of partnering with Maharlika Foundation, Maharlika Charity Foundation. They're doing daycare surgery, and we have a new technique now in anesthesia called regional block anesthesia. The anesthesiologist, through the ultrasound guidance, they inject the anesthetics through certain parts, like pectoralis 1 and 2 blockade. And after a few minutes, it's totally blocked, and we can do our breast surgery. It's amazing that even after surgery, the patient can totally rotate the arm after surgery.
That's
So
incredible.
if we operate in the morning, the patient are discharged in the afternoon. So that's what we call day care surgery for breast cancer patients. And we do that in Maharlika Charity Foundation.
Wow.
The patient, mind you, doesn't pay a single cent for this kind of surgery. That's amazing.
Were you doing the same type of surgery in the hospital before, in SPMC before?
I've been doing this for 2 or 3 years already. In SPMC, we have to admit them.
So there's no choice. You have to admit them
you have
overnight.
to admit them, but they get discharged the following day.
I see. But the benefit here is
Daycare surgery, because actually Maharlika Charity Foundation, they don't have hospital beds. So we really have to discharge them. But the patient can really be discharged even after surgery because they're pain-free.
sure, right. I heard you say earlier that for 48 hours, pain-free. Is that right?
They're pain-free 48 hours because of the blockade.
Yeah. I'm a little amazed with that right now because
It's a new technique, as a matter of fact.
that's pretty
Used to
incredible.
be, we do general anesthesia.
Yes.
The patient has to be intubated. But now with the new technique, no more.
Yeah. So, because with the experience with my mom, which was a long time ago, though, that's, 18 years ago, so I'm sure technology, but with other medical procedures that I've been a caretaker in and helped with, there was nothing like that. I mean, it was, so to have that ability to do that.
To do that, the anesthesiologist should know how to do the ultrasound-guided regional blockade.
Okay. Oh, this is fantastic. So it sounds like, and tell me if I've got it right here. So just for our audience to really understand, we're in the midst of a pandemic.
Yes.
COVID is surging. You were telling me earlier that in SPMC, which is the regional hospital here in the Philippines, actually the largest government hospital in all of the Philippines,
Yes.
correct, is here in southern Mindanao. And it's really a dire situation in terms of COVID. Many people in life-threatening situations. And so as you said earlier, let's say a woman who needs breast cancer, she has breast
Surgery,
cancer and she
yes.
needs surgery, but it's not able to happen because of the resources going to COVID. Is that correct?
Correct.
Yeah. And so because of that, there's a lot of women that are in need, and they need to have this surgery, this life-saving surgery. And through Maharlika Charity Foundation, through your expertise, these women for no cost to them because we're raising funds because of different ones that are donating time and resources to do this. These women can get this life-saving surgery. And I think it's just incredible. We've partnered together to raise funds. We want to invite you to be a part of this because any amount that is given, even a small amount or a large amount, can make a big difference. So Doc Ben, just tell us a bit more about that and what we're doing in terms of raising funds internationally to help these women here.
Yes, thank you for sharing that to them. And we do our math. The current costs of surgeries right now, it would be around 2,500 US dollars for surgery.
In the
And
Philippines?
In the Philippines.
What would it be in the U.S.?
Oh, well,
Do you have any idea?
Definitely is more than that,
Yeah.
But
Tens of thousands.
yes, but right now, the average income of a household here, it does not actually go beyond like 20,000 pesos. That is equivalent to
Yeah.
$400.
So just $400 a month is the average salary for a family's
Our
income.
family. And then here comes a woman diagnosed to have a breast cancer. And with $400 with a family of 5 would not actually be able to access the healthcare because of that 2,500 US dollar cost of surgery.
Mhm.
Now, a 385 US dollars would probably do the trick.
That's incredible. $385 US.
Will do the trick. You can have a breast surgery as well at the same time, a debriefing.
Mm.
For these patients needs debriefing after the surgery.
Mhm.
Okay, so 385 US dollars could go a long way helping a woman diagnosed to have breast cancer in the Philippines.
Mhm.
Well, Amy, we wouldn't be doing this partnering with one of the best surgeons in the city and, of course, global impact. And we are now actually changing somebody's life here.
Mhm.
It might be your sister, it might be your mother. Of course, I'm pretty sorry to hear that your mother has
Mm.
gone to the four winds of heaven. But of course, their memory is still
Mm.
within our hearts.
Mhm.
And mind you that we are addressing that particular iota of opportunity to actually save a life.
Mhm. Mhm.
That's why we are here.
Mhm. Yeah, it's incredible. Okay, so we want to invite you all to be a part of this and to save lives. And in this episode, 2 things: awareness for yourself and for your family members, and second of all, just extending an invitation to partner with us in changing lives, here in the Philippines. So, Dr. Alex, what last words of wisdom would you like to share with our audience?
Well, ladies and gentlemen, October is Breast Cancer Awareness Month. Well, it doesn't only mean awareness, but breast cancer probably has affected each and every one of us. Breast cancer might have affected your family, your relatives, or even your friends. So probably as a form of tribute, you'd like to honor them by giving a donation to help at least a Filipino breast cancer patient in need of a treatment. And I would say I'm knocking in your heart that you would like to help a Filipino breast cancer patient get the proper treatment.
Thank you. Yes. Yeah. And Doc Ben, your last, words of wisdom here.
Of course, that we would like to share to you this noble endeavor for charity that we are now actually in the best opportunity to extend a helping hand. We are now on the side of giving and having this opportunity to actually save a Filipina earning just $400 for a family of 5 would probably go a long way.
Yes. Okay. Well, thank you so much, both of you, for sharing. I know there's so many more things that you could share, but I believe what we've given to the audience, they can take to their heart and help in their own families with awareness, but then also with giving. Again, this topic, this issue is very close to my heart because my own mother had breast cancer, passed away from it, and I want to help women today. And what an opportunity that we have that for just $385 US, we can provide a surgery for a woman that is in need that otherwise would not have the resources to do it. And it's because of doctors like both of you, and it's because of Maharlika and different ones that are also donating time and resources and energy. And so they've been able to bring the cost down to the very, very minimal. And we just invite you to partner with us. So thank you everyone for joining us on this Limitless session. And we pray God's great blessing upon you.